going to the dentist might not sound like something you'd miss until you get toothache, that is. Practices had to close their doors to patients for months at the height of the pandemic, forcing some people to resort to DIY dentistry. New figures suggest more than 2 million people in the UK have tried to take out their own tooth since the start of the year. One of those was Deborah Parrington, who we spoke to a little earlier.
It was driving me up the wall. I was like, sat in on my own. So I just went to the shed and got me a pair of pliers. And with it being just there, I was able to get at it. And I'm pressing on it. I'm thinking, should I be doing this? And then I just went, go for it, bite the bullet. And I pulled it out and it snapped. So I've got a little bit of it. I wasn't going to waggle it about and then pull it out like the dentist might do under anaesthetic. But it was painful, but immediate relief after that. And it's been brilliant since. No regrets.
No regrets. Graphic description there from Deborah. And joining me now to talk about this is dental surgeon Amarinder Setter and Shaz Memon, who's founder of a dental marketing agency. I have to go to you first, Amarinder. Should he have done that?
No, you should not have done that. The amount of infection risk that you can get from that is incredible. Yeah, it probably reduced the immediate pain relief as well. But if we get complications taking teeth out in surgery, the complications you can get doing it at home is intense. Like, he can still get infection from that, so he needs to get seen to. It should definitely not be done at home, especially extractions.
Have you heard of patients doing other kind of DIY dentistry during lockdown?
I've come across such funny stories. A father, for example, attaching with a piece of string one end of the tooth, one end a toy gun, and shooting the bullet with the tooth flying out. I've had another patient paint their teeth with hair dye bleach to get them whiter. And this is the funniest story. A patient swallowing a crown and dinging it out of his feces and then sticking it back in his mouth. I'm pretty sure he washed it, but that's the worst story I have heard so far.
What an image. Thank you for that. Shaz, to you though, the fact is dentists were fully closed during lockdown, and even now people are struggling to get appointments, aren't they? Why is that?
Absolutely right. There's a huge backlog of dental appointments. I believe the figure was 10 million missed appointments. So dentists are working extremely hard to catch up on those appointments. Not to mention the ability to see lots of patients at one time has been reduced due to the additional cleaning procedures and cross-infection control required within practice. So there's immense pressure for dentists. But what I know about the dental community is that they're putting in all the hours to serve as many patients as possible.
What do you think needs to happen to improve the outlook for the industry? Because there have been suggestions that quite a few practices might actually need to close.
Unfortunately, that is a scary truth. 2/3 of dental practices are in financial trouble. The government wasn't too forthcoming with private dental practices and the financial support. So I feel what we need to address is that dental practices have been the safest places in the country pre-lockdown. I mean, they've been wearing masks, and the level of cross-contamination control set by the GDC standards have been so high. So I feel dentists felt that they should have been ready to go back to practice a lot sooner. I think now there needs to be some relaxation on how much time is required in between patients for cleaning. So right now, something called fallow time, a 1 hour gap, a slot is required between an aerosol generating procedure. There is talks of reducing that to 20 or 30 minutes. I feel dentists feel that a lot of this might be more than that, more than necessary. So dentists need to have the permission to see more patients.
Amarinder, you've been talking to us about some of the horror stories, the really dramatic ones. What about general checkups? I mean, children are advised, I think, to see a dentist every 6 months, adults every year, I believe. What do you think the consequences might be of those people not getting their general checkups?
So not getting general checkups means that we will not detect dental decay, for example, at a very early stage, which can eventually lead to tooth pain and tooth loss. My only message to everyone is to carry out prevention, low sugar intake, and very good oral hygiene. And that can buy you some time until we're up and running as normal. So that's my main take-home message for everyone. Look after yourselves, and then we can treat when we're open and fully running as normal.
And if you do find yourself in a position like Debroy, in a lot of pain, unable to get a dentist appointment, is there anything you can do safely to treat yourself at home?
We have a certain checklist and certain things that you can do at home. For example, if you do call us, we can advise you on what you do need to do. For example, painkiller relief, antibiotics only if they are needed, emergency dental kits for re-cementing crowns and fillings. So there are certain things, yes, you can do at home. Call your dentist. If you're not registered with one, call around, because some practices are taking on new patients and they will give you advice on things you can do at home as well.
Amarinder, Shaz, thank you for joining us tonight.